Okay, posterior surface, it is covered by the peritoneum to the posterior surface and reflects the anterior aspect of rectum, forming the rectouterine pouch or pouch of Douglas. And the posterior relation, body, rectouterine pouch with the coils of ileum and sigmoid colon. In the supravaginal portion of cervix, rectouterine pouch with coils of ileum and sigmoid colon. And the vaginal portion of cervix, it is posterior fornix. So posterior surface, it is this is rectum and peritoneum, and between the it is pouch like structure between the rectum and uterus is pouch of Douglas. And up to the body, rectouterine pouch along with the coils of ileum, supravaginal portion of cervix. In the posterior relation, as you can see here, it is same rectouterine pouch with coils of ileum and sigmoid colon, and vaginal portion of the cervix is the posterior fornix. And these are about the right and anterior and posterior relationship, and there are right and left lateral borders also to hold the uterus in the position uh, and not to let it come down. There are the structures called ligaments to hold that, and these are there in the right and left lateral borders basically. Right and left lateral border are rounded and related to the uterine arteries. The supply of the arteries also there. It provides attachment to the broad ligament of uterus. Round ligament is attached antero-inferior to the tube. Ligament of ovary is attached posterior-inferior to the tube, and Meckenrod ligament from the internal or down supravaginal cervix to the lateral vaginal walls. So laterally, body of uterus is broad ligament, uterine artery, and supravaginal portion of the cervix, lateral is uterus and uterine artery, and vaginal portion of the cervix, lateral fornices and of the vagina. So basically, we'll discuss all these in the slide later. So it is the uterus. You can see here, round ligament of uterus. This is uterus and uterine tube, continues to the ovary. This is the superior view. Here you can see fundus of the uterus, uterine tube and ovaries. These are in the reproductive organs. And the lateral, it is round ligament of uterus, which from the and the inguinal canal, it comes inferior epigastric artery and ligaments of ovary. These are the lateral organs of the uterus. And these are regarding the body. And what about the side of vagina? From the cervix. So from at the site of cervix, ureter and uterine arteries. These are the lateral structures. And at the site of the vaginal portion of cervix, lateral fornices of the vagina. In the above slides also, at the part of vaginal portion of cervix, anterior fornix and posterior fornix was there. And laterally, the vaginal portion of the cervix, lateral fornices of the vagina is there. So, vaginal portion is surrounded by the fornices. And during the pervaginal examination, you can feel the fornices also. Now come to the broad ligaments. It is, we see seen here in the lateral attachments of the uterus that broad ligament is there. So in broad ligaments, it is double layer of peritoneum only. The structure of the abdomen, you might remember in the anatomy of the abdomen, the peritoneum lining is there. So this peritoneum only extend in the double layered form towards the uterus, and it forms the broad ligament, side of the uterus to the lateral wall of the pelvis. It extends from the sides of uterus and throughout the lateral wall of the cervix. And it is in the two layers. Posterior layer from meso-ovarium and pierced by the lateral end of the fallopian tube. And you can see the structure in the blue is the broad ligament, and it contains other structures also. This is uterus, vagina, fallopian tube, and ovaries. And lateral attachment of the uterus, that is the extension of the double layer of peritoneum only. The structure in the blue is the broad ligament. And similarly on the both lateral side of the uterus. So content, what it contains: fallopian tubes in broad ligaments only, ovarian vessels in broad ligaments only, uterine vessels, round ligaments, and ovarian ligaments, epooperon and paraooperon, and ovary attached to the posterior layers. These all are the contents of the broad ligament. So in the lateral borders, broad ligament, round ligament, ligament of ovaries, McEnroe ligament. These are the structures, and you can separate it by the body, broad ligament and uterine artery. 15% of smooth muscle is there, and secretions are alkaline, thick, scanty, rich in mucoproteins, fructose, and NACS. Uh, in OPD cases, some of the patient come with a complaint like discharge and all that, and you can see these days add also we wash to maintain the pH and all that. So these are basically to maintain the pH, like the secretions. It is alkaline, thick, scanty, rich in mucoprotein, fructose, and NACL. These are the normal secretions, and anything that alter from that is an anomaly. And there we have first find out the cause of that, then later on treat the disease. It is not always all the time infectious. The infection might be the secondary, and primary cause is something else, like the simple basic cause of constipation may cause secretions, and sometimes physicians keep on treating infections, giving antibiotics and all that. So first we have to look about the cause. If you know about the complete anatomy, likewise here you can see in the boundaries of the uterus, it is rectum is there in the posterior boundary. So if it is the constipation, it may cause the back pressure to the organs, cervix on all that, and this back pressure may alter the pH and all that, or may increase in the secretions. The basic simple cause may be the cause of the disease, and we will treat just the symptom, not the cause. So it will continue. So therefore, have a complete idea about the anatomy and physiology. All that is important. So we were here about the cervix. So here as it is there, 2.5 centimeter, basically divided into two parts, upper supravaginal and lower vaginal part. And we have discussed about the secretions and the cervical wall made up of the outer stroma, connective tissue containing collagen. Only 10, basically it is collagen. Like the uterus was the muscular structure, it contains only 10 to 15% of the smooth muscle, and rest is the structure containing collagen. Now, cavity of the uterus. As we discussed in the introductive process also, it is small in comparison to its size due to thick muscular wall. Base is above and apex is below. As we discussed, the uterus, which had to nurture a life further, it is first surrounded by the pelvic structure or the cavity, and later also uterus is a thick muscular structure, 3 to 1. We read about the dimensions: 3 inches, 2 inches, and 1 inches in length, breadth, and thickness. But the cavity is a narrow structure. This is the cavity, and all this structure in the orange is the muscular. And it is a triangular like, and the base of the triangle is upwards and apex is downward. Cavity of the body, uterine cavity proper, it is a triangular in coronal section. The implantation commonly occurs in the upper part of its posterior wall. Implantation means the developing fetus, when it is in the embryo stage. A zygote after that becomes embryo. So implantation commonly occurs in the upper part of the posterior wall. It is a slit in vaginal section because the uterus is compressed antero-posteriorly and its both wall is in almost in contact. This is upper part, and here also in the posterior wall implantation is done. And it is a slit in sagittal section if we'll do the sagittal section of the uterus, and because the uterus is compressed antero-posteriorly. Here also in two-dimensional figure you can see and correlate that. Now cavity of the cervix or cervical canal. It is spindle-shaped canal, broader in middle and narrow at the ends. Nulliparous women, external os is small and circular, and in multiparous, parity is related to the times of pregnancy. Nulliparous is never pregnant, and multi-pregnant parous is pregnant for multiple times or many times. So you can see these terms constantly in different lectures. So be adapted with these. Parity or parous is related to number of pregnancies. In nulliparous women, external os is small and circular. And due to the multiple deliveries or pregnancies in multiparous women, external os is large and transverse and presents anterior and posterior lips. We can differentiate about the anterior and posterior lip. Anatomical internal os and histological internal os are the that is slight change in epithelium lies below the anatomical internal os. Distance from isthmus is 0.5 centimeters. So this is of the nulliparous women, circular and small. Opening you can see here small, and in multiparous, these are the lip-like structure, anterior and posterior lip. This about the cavity of cervix, and the cavity of uterus is different point. Now about the ligaments. Ligaments we discussed earlier also in short. Hope you recall it. In the right and left lateral borders. About the uterus and its border, we have discussed body anterior body isthmus. After that, we discussed about the anterior surface. It is surrounded by the uterus, peritoneum, uterovesical pouches, and fornices. Posterior border by rectum. Pouch of Douglas is formed between the rectum and uterus, and similarly peritoneum and fornices. And right and left border, fornices are there in the vaginal portion, and above that there are the different ligaments basically, and we'll discuss about these ligaments only here. So ligaments of the uterus are classified in two types: false ligaments and true ligaments. The false ligaments are peritoneal folds. We just discussed about the broad ligament. So broad ligament is the double fold peritoneal structure that is extended towards the uterus. So will you classify that ligament or broad ligament in true ligament or false ligament? Because here it is written the false ligament are the peritoneal folds, whereas true ligaments are the fibromuscular bands. So here we classify that broad ligament as the false ligament. because these are the structure covering the lateral side of uterus, but that is not basically the fibromuscular band which bind the uterus. The false ligament do not provide support to the uterus, while the true ligament provides support to the uterus. So what kind of ligament come under the false ligament and true ligaments? It is classified here. False ligament, broad ligament. These are paired bilaterally on both the sides. Recto-uterine folds. These are also false ligaments and paired. Uterovesical fold in anterior ligament and rectovaginal fold in the posterior ligament. These are unpaired. Anterior side of uterus is urinary bladder, and the ligament between the uterus and bladder is uterovesical fold, and the ligaments between the uterus and rectum posteriorly are the rectovaginal fold, and these are the unpaired. And broad ligament and rectouterine folds are the paired. And about the true ligaments, these are the fibromuscular bands are the round ligaments, transverse cervical ligament, uterosacral ligament, and pubocervical ligaments, and these are the paired structure that provide support to the uterus. Now, supports of the uterus, primary support by the fibromuscular structures, muscular pelvic diaphragm, perineal body, urinogenital diaphragm, ligamentary support are pubocervical ligament, transverse cervical ligament, uterosacral ligament, and fascial support is endopelvic fascia, vesicovaginal fascia, rectovaginal fascia, uterine axilla, and round ligaments.